start yet?
Hello, good evening. Welcome to the first episode of CripChat, your weekly podcast on everything disabilities. I'm your host, Jonathan Shaw, and with me is Abby. Hello.
Hello everyone, how are you? So yeah, I'll just introduce myself. My name is Evie, and thank you, Jonathan, for inviting me to join the podcast.
Thank you for joining us. Why don't you tell us a bit about yourself?
Okay, well, I am an NDIS participant, and my background is accounting, and I do utilize my NDIS to go out. So I use support workers, and I buy I guess equipment to improve my livability. So with the crisis in hand, it's been a bit of a journey. It's been a bit difficult accessing services and whatnot, but we're trying to manage. I guess it's all about having a positive attitude, and so yeah, that's just a bit about myself. So thank you, Jonathan.
How are you coping at the moment?
How old am I?
How are you?
Well, I'm feeling fine, which is a good thing. I'm doing okay. I've been self-isolating for the past 5 days, and it's so far so good. So I'm managing. I'm looking after myself, regularly washing my hands. You know, just keeping healthy, I guess. So yeah. And how have you been holding up, Jonathan?
I've been doing well apart from a few trusted care workers. I haven't been going out. I've been trying to limit contact with other people.
It's good. It's good. It's all about social distancing, limiting our social distance, our social connections. Sorry.
What do you think of the government response? Do you think they could be doing more to accommodate people with disabilities?
Look, I think the government has been really slow in responding to the outbreak, I guess. We are a bit delayed in terms of other countries. I think we should have been in total lockdown a week ago just to avoid the spread. I think the way they managed people who came from overseas was poor. They should have isolated them as soon as they arrived, just to stop the spread. But unfortunately, it is what it is, and now we just got to look after ourselves. And also, sorry, with the schools, just the schools. I understand that kids need the education, but health is another topic that they should look after.
I think apart from Jordan still John, no one is actually bringing up disability in the COVID response,
Well,
which is a shame.
it's kind of like I guess it's kind of make life harder for people with disability in managing the situation at hand. It's all about looking well after yourselves, ensuring that the support workers are well educated about being washing their hands, just to ensure that the infections don't spread onto you. It's all about taking care of yourself because the government's, I guess, response to people with disability is it's not there yet. It's not there yet. Yeah.
If you were in government, what would you do differently?
Well, first thing first, I would place a total lockdown for at least 3 or 4 weeks. I know it's a struggle for most people, but you just to ensure that the virus doesn't spread in the communities. For people with disability, um, we just need to, I guess, that they're well looked after and make them like not our first priority, but put them up there on the list along with the elderly as well, because apparently they're the most at risk. Um, so just having a safeguard for people with disability and also for the elderly, ensuring that they are well looked after, and also just educating the public you know, um, about how to manage, like for support workers, how to manage people with disability, washing hands, being looking after their hygiene. So yeah.
Do you think providers need more support to implement online services?
Yes, definitely yes. More support is needed, especially at this time. More support is needed for people with disability. So yep.
I personally think the price guide for the NDIS needs to be updated to better support remote practice.
I guess due to the economic instability that we are facing, I guess with the NDIS, I think the price card, I think the prices should be lower, just for just for this temporary period of time, just until the COVID has gone past,
Uh,
just to so we don't fall into a recession, which we are looking towards. It's kind of scary, but it is what it is.
are you concerned that the government may use the looming recession as an excuse not to invest as much in the NDIS?
I am very concerned. I am very concerned. Most people with disability rely on these supports from the NDIS. So it's going to be a challenge if something was to affect the NDIS, especially for people with disability. We are looking at tough times, but if we all stick together, we can overcome this. We just need to stick with what we've got, follow the rules, just look after ourselves.
Yes, and I think we need more public voices to speak for us.
So can you repeat the question?
Do you think we need more people with disabilities in media advocating for ongoing support?
Oh yeah, of course we need more people with disability in the media. We need people's voices to be heard. We need people to raise their voice on the issues that they're facing, and just to show the government that we really do need the support, especially at this time.
Is there anything you want to ask me?
So yeah, how are you utilizing your NDIS now that workers are being limited and all the supports are limited? How are you managing with your NDIS?
Well, currently I'm still attending university, but I'm doing it online. So basically, what I use my support for is helping me take notes, helping me type up assignments.
Yep, yep.
What about you? How are you using your NDIS?
Well, I'm utilizing my NDIS for emergency. So, like, I'm a wheelchair user. So, if my wheelchair ends up breaking down, I can utilize my NDIS funding for, I guess, repairs and maintenance. That if I do need the physio, I can get like an OT, what do you call it? My physio to come up with I guess, a plan on how a fitness plan, I guess, which I can follow from home. I can, I guess, go use my funding to build for capacity building for specialists, and I can, the beauty of that is I can do it all online.
Yeah.
Yep. So how are you managing at this time? Are you feeling good?
Well, basically, at this stage, I'm still maintaining
Yep.
my level of personal care. I have about 7 hours per week,
Yep.
and for the time being, I hope to maintain it. However, I am concerned if the pandemic continues, if I may need to stop my services.
Yeah, that's one of the main concerns. Apparently the pandemic will go on till June, maybe go on for 6 months. But hopefully, if they put the necessary measures in place, it will be over soon. So we just gotta put faith in, I guess, ourselves, our community, and just follow the government, what the government says. But it all starts with you. You gotta take precaution. Isolate yourselves just until this disease goes away.
What else is happening with you?
Well, I got family, so and we try to isolate ourselves from each other. What about you? Who do you have living in your household?
I live with my family, and I'm mainly staying inside, not going out,
Yeah.
limiting contact.
Yes. Yes. Avoid as much contact as you can. Avoid going outdoors just for the meantime. Um, I guess if you are bored, I guess just take a walk around the backyard. Read, play video games, keep yourself occupied.
Mm.
Or, what else could we do while we're in isolation? What are some tips you can give us?
Well, basically, stay occupied, play games on the computer if you can study something. The internet can be a great enabler. Use it to enrich your knowledge.
And you can always use online platform to stay connected with each other, just to see how everyone's doing.
Yeah,
So you can always reach out to people even if you're in isolation.
yeah.
It's good stuff.
Just remember everyone, the disability community is here for you. If you're feeling lonely, just reach out.
Reach out, exactly. Just
Yeah,
remember, we're all in this together.
yeah,
We're all fighting this together. We can get through this. We just need to support one another.
yeah. And if you have a problem, feel free to reach out.
Reach out, that's it. All you do is reach out. Good stuff.
Reach out.
It's all good. Is there any other advice you want to give?
Also, stay in touch with your organization.
Yeah, and
Sure,
stay in touch with all your peers as well.
sure, they may not be in their offices, but they're still out there to help whenever you need.
Good stuff. Good stuff. It's all about, yeah, just staying in touch.
Yeah.
Stay in touch. We are one community. And like I said, we can get through this.
As long as we stick together and don't let anything divide us.
That's right. Yeah. Good stuff. Good stuff, Jonathan.
Is
Okay.
there anything else you want to discuss?
Well, I'm just look after yourselves, just stay healthy, and just remember this is temporary. So just stay positive.
And just remember, if we stay isolated, we can come out at the end stronger.
That's right. We'll get stronger.
Yeah.
Good stuff. Good stuff, Jonathan.
Okay.
Okay, so I guess this is the end of the podcast.
Okay.
I would like to thank you for inviting me once again to be a part of the podcast, and I look to many more.
Thank you so much. And people at home, let us know what you think and what you'd like us to discuss in the future.
Yeah, just let us know.
Okay. Bye for now.
Bye for now. Be in touch. See you later.